Hello, everyone. I'm Dr. Edward Mooney. I'm a professor of educational psychology, and I did a lot of research on trauma. My keynote work is the effects of the trauma of witnessing a school shooting on a teacher. My specialty is what is the effect of violence, trauma, and things like that on the school system. I'm feeling kind of overwhelmed, as many of you are right now, because there's nothing I feel I can do sometimes, because we're in a very strange situation with this COVID-19 problem going around. The pandemic makes us feel all out of control. All of us are feeling helpless, overwhelmed, unsure, lost, not sure how to make decisions. And a lot of people are scared because of those feelings. And we start turning into ourselves. We start putting ourselves down, and we start feeling less secure. And I felt, well, this is my little way of kind of reaching out to help people who are struggling, as I am, to know what's going on. Well, first of all, please realize that trauma is not just going off to war. And by the way, I am not diminishing the trauma of people who've gone to Vietnam, Afghanistan, Iraq, and all those other places. That's real trauma. But that's not the only kind of trauma. So in this little presentation, I want to talk to you about what trauma is, kind of what are the symptoms, how can we treat it, and when should you seek professional help. Okay, well first, what is trauma? Trauma is an emotional and physical response to a terrible event, like an accident or a natural disaster or a pandemic. I've found that people are surprised when I say right now we have a society-wide trauma going on, and all of us are dealing with it in different ways. But I want us to acknowledge that this is a trauma of sorts. It is outside of our control. We're feeling emotional and physical responses to it, and it's overwhelming. It's kind of a, I hope, once-in-a-lifetime thing. We've not had this before. The last one was 102 years ago. There are very few people who lived through that one who are in this one right now. So let's talk about what causes trauma. Well, you can have one-time events, such as an accident, an injury, or an attack. And these things are often unexpected. And by the way, these can include things that happened in your childhood as well. I struggled with an abusive alcoholic father. That was a trauma. There are ongoing traumas, which I think we're going through right now. If you've had a long-term illness, it can be seen as a trauma. If you live in a crime-ridden neighborhood and it's just day to day, you're always struggling with it. And then there are some traumas that are often overlooked, like having someone you love die, or some extremely disappointing experience, a severe humiliation, or the sudden loss of a relationship can be a trauma. Well, this one, the pandemic, is a sort of ongoing trauma. How do we know we're feeling trauma? You might want to just kind of mentally do a self-test when I go through some of these symptoms. Well, there are emotional and psychological ones. Let's look at those first. Shock, denial, and or disbelief. Is this really happening? My wife made a joke that she wished she had $1 for every time I said, these are strange times. That fits that. Then there's confusion and difficulty concentrating. As I've been working over the last month on a book that I'm writing based on my research, I find I'm writing right in the middle of a paragraph, and I'm sitting here saying, where do I go next with this? I forgot. So I'll have to walk away and try to come back. Previously, I could have probably, written 5 times what I do in a day. Third one, anger, irritability, and maybe some mood swings. We're seeing a lot of anger in society right now. People want to be free. They want to go off and do what they want to do. And I understand that. Anger is a secondary emotion, or as I like to put it, it's an outward expression of a different inward emotion. For me, and my wife knows this well, when I feel anxiety or fear, it often comes across as anger to her. So we're seeing a lot of that, I think. Guilt, shame, and self-blame. I'm aware of some people who have lost people in the hospital or have people dying in the hospital and they can't get there to them. And they feel great guilt and shame. You don't have to feel that. These are strange situations. It's not in your control. There's another hallmark of trauma. It's not in our control. Another one is oftentimes we withdraw from others. The reason is we're afraid of being hurt. And when we're close to others, the possibility of being hurt goes up. Feeling sad or hopeless. And I want to tell you, I've been there. I understand that. This is why I'm recording this. I'm hoping to talk to you, the people who are feeling hopeless and sad, saying, we will get through this. Ever since I was a kid, I've been reading about the Second World War, and I've been interested in history all my life. And I read about what people went through during the Depression and the Second World War. There was a sense of hopelessness. It was overwhelming to be fighting one country in Europe and another country in the Pacific at the same time. And where are the ones I love? They're over there somewhere. We're all together in this. All Americans are feeling this hopelessness and this sadness. There's also a feeling of being disconnected or numb. Sometimes when emotions are too overwhelming, we just kind of shut them down. Watch out if you're using alcohol or drugs to do that. Then it could become very self-destructive. What about physical symptoms? Yes, trauma manifests itself physically. I would like to recommend a man I deeply respect, Dr. Bessel van der Kolk. He wrote a book called The Body Keeps the Score. And what he means by that is trauma manifests itself in our physical systems. One of the most common one is, and I've seen this in my wife, is our neck and shoulders the muscles tighten up and it just aches. Joints can do the same thing. If you're sitting strange for a long time in stressful conditions, it'll put a wear and tear on your joint. The thing is you're so focused on the trauma, the stress, you don't see what's going on with the body. Another one could be dental issues. Grinding of teeth sometimes can do that. I leave this to our medical and dental experts to work with the physical symptoms. But some of the most common ones are insomnia or nightmares. And I've had some very difficult dreams recently. They come out of the blue, and they're ones I've never had before. Dreams are like your unconscious, subconscious mind trying to tell your conscious mind about some emotions. I notice mine are about, I'm struggling with things I can't seem to understand, or I don't know what to do with them. Look at the emotions of your dreams. That'll give you clues as to what you're feeling inside. Being startled easily. Someone lit off a firecracker in our neighborhood, and I jumped. Because our startle response, our anxiety is on high alert. And you hear a loud sound and you freeze or you stress. That's normal in this situation. By the way, trauma is a normal reaction, these symptoms of trauma are a normal reaction to abnormal events. Don't think there's something wrong with you. These are strange times. Your body, your psychology is responding to very strange things that you haven't had to cope with all your life. Racing heartbeat. Fear and anxiety can get all the systems racing. Deep breath. Exercises. Get up and walk around. Things like that. Edginess and agitation. Who hasn't found a dirty spoon on the counter and think, why does she leave that there? I'm upset about this. Now I have to wash it. Are you listening, Caroline? I cleaned it. Aches and pains, as I said. By the way, digestive disorders, lower digestive disorders can come because of trauma. Muscle tension is probably one of the most common physical symptoms. Once again, I would recommend Dr. Bessel van der Kolk's book, The Body Keeps the Score, if you're having these symptoms. I used his research a lot in my own work, and have great admiration for him, having also been someone who had abuse as a child. Now, what can you do about this trauma? Well, first of all, get moving physically. And by the way, this won't cure it. These are just things you can do. And any physical movement can help. I redid my toolbox out in the garage. I have like a bench area, and I was always complaining that I couldn't find my hammer because I would just throw tools on the bench. Yeah, I'm not good with that. I'm better at writing than I am with tools. But I went out and spent 2 days just reorganizing it. Now I go out, and it gives me a little joy, and I'm like, here's the drawer where my screwdrivers are. Here's the drawer where my wrenches are. I'm like, oh, this is good. And actually makes me feel a little better about myself. So psychologically, you feel better about yourself. Physically, you're burning some of that tension energy. Go out in the yard. I mow the lawn. I was going to hire a gardener. I'm sorry to those people who are gardeners, but I need physical exercise. I can't go to the gym right now. And I found going out and cutting branches or mowing the lawn or fixing the sprinklers, I still have to do that one, is good for me. And when it's done, you look at it and you go, that bush looks nice now. So physically and psychologically, physical motion helps a lot. Self-regulate. What the heck does that mean? Well, the one thing I've learned growing up and through my research, we're not often aware of our emotions. We're not often aware that we're anxious. You've got to own it. To be able to start giving yourself some healing and some peace, you have to come to grips with what you're feeling. Look inside. I'm fortunate that I have a wife I can say, what do you think's going on with me? And she does the same to me. And we'll give honest feedback because we care about each other. We want each other to get through this. For those of you living alone during this, you can still use email, Zoom calls, use the phone, connect with people somehow. If you're in a situation where you're not so well off in your family, where there's some troubles, find a way and a place to feel safe. Call someone for help. Take care of your health is another thing you can do. I push myself when I get out of bed. There are days when I don't have this rigid schedule like I used to have. I go brush and floss my teeth. I go and wash my face. I shave. Comb my hair. I know there's not much there to comb, but I do it. I put a clean shirt on. I'll probably wear sweatpants most of the day, but they're clean. Take care of your health, eating regularly. Don't overeat on the snack department, for example. Physical exercise, you can't go to the gym. My wife has just walked around the backyard listening to music. Walk around your neighborhood, social distancing. Take your dog out or something like that. Now, what if all of these things are not enough? There are going to be some of us who are going to need to reach out for professional help. And please notice that I said us. The one thing I'm noticing is there are a lot of mental health professionals who are struggling too. We're just as human as anyone else. And for those people, I'd like to do a special shout out. You are doing a wonderful thing. You are on the front line, just like the medical doctors, just like the nurses, just like the grocery store workers, and everyone else who's doing everything they can to keep our society functioning. Take care of yourself is my number one thing to counselors and psychologists. And I know I don't have to tell you, but I want to remind you. So here's what you should look for. First of all, if you're having a lot of trouble functioning, if you've found that every day some things you're doing are just harder and harder to do, you might want to think of calling someone. Number two, if you feel that the fear, anxiety, or depression are becoming just the only thing in your life, I have a good friend. His name is Rick Wyatt. He has a flag store, and he knows that I have a hobby of collecting flags. So he sent me some flag stuff, and I have a little flagpole in my backyard, and I'm using that as my kind of my symptom. I find joy in going out and putting a flag up. Oh, there's Denmark. Oh, that one's Norway today. Oh, here's California's flag. Oh, that's Colorado's. And it gives me a little joy. Yesterday I took a couple nice pictures of some flowers, some tulips in our yard. I'm looking for simple joys. If you're unable to find some of those things that usually you like, then think about calling someone. If you find all of a sudden you're very distant from your loved ones, you can't connect, call someone. If you're experiencing bad memories from the past, or severe nightmares, or flashbacks, where something reminds you of a pain from a long time ago, call someone. By the way, new traumas can also kind of intrude on old traumas and reawaken them. You're not bad. There's nothing wrong with you. That's to be expected. Call someone. If you're avoiding anything that reminds you of any traumas, call someone. If you feel completely numb, if you, being honest with yourself, cannot really admit how you're feeling, talk to someone. By the way, that's normal in trauma. We don't want to feel those negative emotions. We'd rather feel happy. If you feel disconnected from others, if people are saying, what's wrong with you? You don't talk to me or something like that. And I want to stop and talk to us guys a little bit. There's something in our culture that tells us men should not need to talk about psychology or feelings or any of this stuff, relationships. It's garbage, men. Real men can own their emotions. The strongest men I know are some of the most emotional men I know. And I've come to believe that it's a strong man that can face the emotions. Finally, the one thing I want to urge you to do is to avoid overuse of alcohol and drugs. If you find you're doing that, talk to yourself and say, hey, maybe this is a sign I need to reach out and get some help somewhere. Well, what can I do for others? That's the last thing I wanted to cover here. That's why I'm doing this video. I'm taking what little I know, my little tiny corner of educational psychology, trauma, and trying to reach someone. Does this cure everything? No, it probably won't. Could it help one person reach out to their healthcare provider? If that's true, then this was worth it. Could it help a husband and wife start talking to each other? Then it's worth it. Now, I ask you, look at your skill set. What are you good at? What can you offer? Is there a neighbor down the street, for example, that needs to have their sprinkler fixed like I do? And you're good with that. And it's socially distant. You can be outside. Say, I want to fix your sprinkler. Do you know little acts of caring, of kindness can change this loneliness? Being alone is one of the deepest pains of trauma. Being abused, you feel you're alone. You feel like no one understands. There's something wrong with me. Going through all trauma does that. If you can go fix somebody's sprinkler or their car or keeping socially distant, whatever it might be, you might really change someone else's life. So take whatever skill set you have and give it to someone else. You never know. They may come back and do the same for you in a different way. If you're good with cooking, leave some chocolate chip cookies. I kind of like them in between soft and crunchy. But leave them on their front porch. That could just really bring a smile. Right now, smiles go a long way. A sense of humor can go a long way. I was talking to a friend of mine who's a Catholic priest, and he told a joke, and I just started laughing. I don't know if I would have laughed before. He said, do you know what they call a rectory, a place where priests live? And I went, no. And he said, a home for unwed fathers. And I just broke up laughing. I noticed he loves to tell jokes. And I noticed I look forward to hearing from him. By the way, it's hard. Yes, I know all these things are hard. Do what you can. And I want to leave you with that. Every day, just do what you can. And don't beat yourself up if you can't go and do everything you thought you could do. Well, I'd like to sign off by saying my name's Dr. Edward Mooney. professor of educational psychology. And right now, we're all going through trauma, and I care about someone else. Spread the care. Take care.